Let's start out our workout with some stretches. So first, flexion is when you make the angle at the joint smaller. So we're going to flex the atlanto-occipital joint, and this is the flexion of the sternocleidomastoid. Next, we're going to do an extension. Extension is when you make the angle at the joint larger, and this time we're going to extend the proximal radial ulnar joint, also known as the elbow. And this is the extension of the triceps brachii. Next, we're going to do a hyperextension. Hyperextension is excessive extension of a joint in a certain direction, and that is over 180 degrees. So we're going to hyperextend the atlanto-occipital joint. This is the hyperextension of the splenius capitis, semispinalis capitis, and the trapezius. Next, we're going to do a lateral rotation. Lateral rotation is turning outwards from the medial line. We're going to laterally rotate the talocrural joint, which is the ankle. This is the lateral rotation of the fibularis brevis and the fibularis longus. Next, we're going to do a medial rotation. Medial rotation is the movement turning inwards towards the midline. We're going to medially rotate the talocrural joint, or the ankle, and this is the medial rotation of the tibialis posterior and the tibialis anterior.
Hello everybody. Today we will be demonstrating elevation and depression. For elevation, it is the movement in the superior direction, which is towards the head, or thinking of to the sky. And depression is the downward movement, so you're thinking you're going to the ground. So for this, we will be using the example of shoulder shrugs. So when you bring your shoulders up, this is an example of elevation because you are bringing your shoulders up to the sky or to the superior direction. And when you bring your shoulders down, it is depression because you're bringing your shoulders down to the ground in a downward movement. So shoulder shrugs, elevation, depression. And when you elevate your shoulders, this is an example of targeting the shoulder joint and the elevation of the trapezius muscle. And then when you drop your shoulders in a shoulder shrug, this is the depression of the shoulder joint and of the trapezius muscle.
We'll now be discussing the plantar flexion and dorsiflexion of the ankle. In this, plantar flexion is the movement that points down to the ground. You want to think of yourself pointing towards a plant, your toes towards a plant, while dorsiflexion is the upward movement, bringing your ankle up in the superior direction. So you want to think of yourself pointing to the sky. For plantar flexion and dorsiflexion they both target the talocrural joint. So when I lift my ankle up, this is dorsiflexion, and when I point it down, this is plantar flexion. The muscles being activated in plantar flexion are the gastrocnemius muscle, the plantaris muscle, the soleus muscle, and the fibularis longus. When I dorsiflex, this is activating the tibialis anterior, the extensor hallucis longus muscle, and the extensor digitorum longus muscle.
We're going to be doing some exercises. So, the abduction is the movement away from the midline of the body, and the adduction is the movement towards the midline of the body, and that uses the glenohumeral joint. The muscles used are the supraspinatus and the deltoid trapezius and serratus anterior muscles for abduction, and adduction uses the pectoralis major, latissimus dorsi, teres major, triceps, and coracobrachialis muscles. The next exercise is circumduction, and so that's when you move your arm in a circular motion, making a kind of cone shape. Circumduction is also uses the shoulder joint, so the glenohumeral joint, and it uses the muscles supraspinatus, infraspinatus, teres major, and subscapularis muscles. Our last exercise uses the movements pronation and supination. Pronation is when your hand and arm move inward and your palms are down. Supination is the opposite, when it rolls outward and your palms are up. These movements use the pronate and pronate proximal and distal radial ulnar joints. Pronation uses the pronator quadratus, the pronator teres, and the brachial radial muscles. Supination, which is when your palms are upward, uses the spinator and biceps brachii.